Hello friends of TV Agro, my name is Maria Isabel Rodriguez. Today we are in the Kennel San Samuel de Abril in Tabio, Cundinamarca. Today we have a very interesting and important topic. We are the reproductive processes. Today we have a very interesting and important topic, which are the reproductive processes that we carry out in our hatchery. The first part of this topic will be presented by Dr. George Pinzon. He will tell us everything we have to do to achieve a successful pregnancy. But then you may ask, and after the pregnancy, what should we do? And that is where our Dr. Laura Rubiano comes in. She will explain us all the preventive measures that we must achieve during gestation to have a healthy and full-term calf, like this beautiful specimen that we have here called Charlie Brown. Join us to learn with us today many important things. Hello friends of TV Agro. We are here at the San Samuel de Abril breeding farm in Tabio, Cundinamarca. My name is George Pinzon. I'm a veterinarian from the National University. I do all the part of the reproduction process in this breeding farm. Here we normally dispatch semen for all parts of the country, from all our breeders, both Gypsy Vanna and Frisian breed. Additionally, we do the washing program and embryo transfer. Here we have Genesis, one of our embryo donors, and we have other types of Gypsy Vanna donors. Today we are going to make a semen collection to make artificial insemination of another of our donors, to later make the synchronization and do the embryo washing later on. Our process begins with a synchronization of the astral cycle of our donors with respect to our recipients. The ideal is that they are at the same point of the reproductive stage, both of them. The mare that we are going to serve today is in estrus, and we are working with a recipient that is also in estrus. We select the recipients according to their thoracic capacity, abdominal capacity, and according to their pelvic amplitude, so that we will not have any problem at the moment of delivery. Although it is true that mares regulate the size of their offspring, we look for an important calving facility so that we do not have problems in our recipients at the moment of delivery. Once we have finished with synchronization process and we already have our suitable donor ready to be served, we collect the horse, the selected reproductive. We simply collect and perform artificial insemination. In this particular breeding farm, we do not direct mating. We evaluate the semen very well, and later we perform the artificial insemination. In this particular mare, we are very attentive to the moment of post-service, the moment of ovulation, and from that moment on, we count 8 days to perform the washing and embryo transfer. We remove the embryo in 8 days, and in 8 days we transfer it to our recipient, which must have very good characteristics of a stage of the astral cycle called distress, to later transfer the embryo and thus achieve a gestation in our recipient. In this case, I'm going to evaluate a recipient embryo to which the embryo washing and transfer was done 8 days ago, and we would do the confirmation of gestation. Friends, we show you the quality of our recipient. They are animals that are quite big. They have a very good abdominal capacity, and besides that, they have a very good hip width. They are mares that besides that have very good milk quality, and they will feed our fowl in the best way and with the best possible quality. We select recipients that are very tame and that we can simply attend the births and that we will not have any type of problem or any type of inconvenience when the time of delivery arrives. Our recipients are also going to be used according to their behavior. As you can see, they are recipients that have a very calm behavior. They are very calm and very tame recipients. This is also going to be instilled or taught to the fowl and will not have any inconvenience with our fowl after the birth. Hello friends of TV Agro, how are you? My name is Laura Rubiano, veterinarian. Today I'm going to talk to you a little bit about the follow-up in the gestation of our animals. Today we are with Anita, a mare that at this moment is 7 months pregnant. Today we are going to make the evaluation of her pregnancy. To begin with, we have to keep in mind with our mares, once inseminated, after the first months of gestation, must be a well-supplemented mare. A mare that is fed correctly. Her gait must be as indicated, depending on the type of soil, supplemented with mineralized salts. Calcium is often very important during gestation and very well fed. Once we reach the 7th month of gestation, a transabdominal ultrasound is performed. That is to say that we are going to enter with the equipment that we see here, so we can observe how the calf is here inside, the part of the body and the horns of the uterus, and also a transrectal ultrasound will be performed, which is to enter through the mare's rectum with an ultrasound machine and see the part of the cervical star. This area is called. Very important to determine placental pathologies. These are almost around 30% of losses, abortions, dead neonates, stillbirths. The whole subject is produced by placental pathologies in many occasions due to placentitis specifically. This ultrasound here helps me to determine in early stages the placental disease in the mares and to be able to give timely treatment. Not only the ultrasound is going to help us for this, we can also help us with the laboratory diagnostic tools in this case, such as the measurement of progesterone, the measurement of estrogens, which are hormones that are produced either in the placenta or in the fetus, which leave the maternal circulation and allow me to measure if their levels are out of normal ranges, to know that there is something altered at this moment in the fetus maternal unit. What are we going to do at this time? We will perform an ultrasound to evaluate the animal. We will touch it, we will observe the udder. Depending on the month in which we do the ultrasound, we can see the udder, the development of the udder that occurs about 2 to 6 weeks before delivery. In this case, the mare's udder should be very small as we can see. We lubricate our ultrasound machine well with a transducer gel and we moisten the area with alcohol to reduce interference. This way we can evaluate the utero-placental union. That is to say, the uterus and the placenta have a specific thickness in gestation. Depending on each month of gestation, that thickness increases, more or less 1 millimeter per month. We can talk about how thick the utero-placental union is, and we will also evaluate, for example, the fetal morphology. In this case, we will see the fetocardia of this baby. We will locate the heart. Many times we can locate it either by the ribs that we see in the ultrasound or the heart appears directly. In this case, we see the baby's heart. We see how it beats. We count the beats per minute of that heart, and we compare it according to the month in which the mare is in order to know if it is normal or abnormal. With our newborn foal, what are we going to evaluate? Approximately the fowl should stand up during the first hour of life. It should feed during the second hour of life, within the first 2 hours, and it should defecate more or less at the third hour of life. Once a fowl is fed, usually this food is used for the fowl to defecate. We should observe the presence of meconium. This meconium is dark. It is hard, it is very characteristic. Additionally, we are going to evaluate the navel. The navel, we must cure it with iodine. It is very important so that no microorganisms enter it. We can even put our hand here and touch the navel, observe the extremities of our animals, see that there is no increase in temperature, that they are completely straight. Sometimes they can be born with the extremities a little bit lying down or even a little bit contracted. That is to say, as if they were flexed, and we must keep in mind that if the fowl does not stand, it could be for some of these causes. Additionally, we must be very aware that the fowl, or in this case, the filly, urinates. This amount of urine is given as the fowl feeds, and nurses normally, we must be very aware that the fowl follows his mother. As I told you, is very important. With this, we can evaluate and determine the mental state of the fowl. The fowl that does not follow his mother is a fowl that we must intervene. We must either call a veterinarian or pay even more attention to this fowl, because he surely has problems in his adjustments. Hello friends of TV Agro, my name is Ana Maria Gomez and I'm here with my partner. My name is Julian Poveda and we are students of veterinary medicine. Currently we are interns at the San Samuel de Abril Kennel, located in Tabio, Cundinamarca. According to the recommendations of Dr. Laura Rubiano, we'll talk about the dietary supplementation protocol. We'll start with an iron-based supplement, which works mainly for the formation of blood cells. This supplement is given on days 2, 6, and 12 from birth, once the fowl is healthy. With this dietary supplement that we seek is to improve the whole part of the metabolism and also to avoid diseases such as anemia or malnutrition. Additionally, after the first week of birth, we use a calcium-based supplement. This is for the proper formation of calcium, since the first year is of vital importance for the whole part of cartilage formation, bone ossification, and so it must be supplemented adequately. To improve the bacterial flora, we will use another supplement based on probiotics, prebiotics, monosaccharides, oligosaccharides. With this, we will improve the whole part of the digestibility in the part of the food and also in the absorption of the same. Between the 5th and 6th month, which is a crucial time for them, post-weaning, we use a supplement based on microminerals, macrominerals, essential amino acids, and yeast, with the aim of developing a good intestinal microbiota for proper digestion, absorption, and thus generate a good performance in the development of muscle mass, body mass, and to express their full genetic potential. Thank you for joining us today. I hope you have learned a lot, and please remember to follow us on our social networks. We are as San Samuel de Abril Criadero. See you next time.